So first off, thanks for coming tonight. I have about a half an hour speech on the Affordable Care Act. I have a 45-minute speech and a 2-hour speech. And you're going to get 10 minutes tonight, so it's going to be a very high overview really quickly. And I won't go through the long one, because what you're really going to hear about is the part that applies to you, which is the part that's covered Oregon. I'll give you a quick overview of how we got where we're at and what this big change in healthcare is going to mean to a lot of people. I always start my lecture, and it was here, you can see a slide up that's one of my favorite quotes from one of my favorite people, Winston Churchill. And the quote is, you can always count on the Americans to do the right thing, but only after they've tried everything else. And the question before us, are we doing the right thing, or are we just trying everything else one more time? I believe we're doing the right thing. It's the first step towards universal health care in the United States since 1964. That said, there are some issues. The first thing you need to know about American health care is that we spend twice as much money per individual in the United States than any other country in the world. Twice as much. There's lots of reasons for that, but we do spend twice as much. If we were twice as healthy as any other nation, I might be okay with that, but we aren't. In fact, we rank about 40th in the world as far as health care of our population. We are one of the unhealthiest populations in the world. There's lots of reasons for that: cigarette smoking, obesity, lifestyles. But one of the big reasons for that is that in all the first world countries, we are the only one that has people that are uninsured and have no health insurance. And that's a real burden on our system for two reasons. One, people who don't have health insurance delay their treatment. They don't get preventative care, they delay their treatment and come into emergency rooms and hospitals late in their illness, get coronary bypasses, get their hearts replaced, lungs replaced, kidneys replaced, all because they didn't take care of their hypertension, their diabetes, their hyperlipidemia. And because they haven't done that, because they didn't have insurance, there's a huge cost to it. And those people don't have insurance. They file bankruptcy. You should know the #1 cause of bankruptcy in America is medical bills, if you can believe it. And that cost is shifted to the rest of us, and we pay for it through higher premiums in the insurance that we buy. So the Affordable Care Act, Obamacare if you will, is designed to stop that. It's designed to get that 40 million people in the United States insured. And that's its only real goal. The idea of driving down costs inside the system is not a part of this. This is about getting more people insured, solving what we call that cost shift. So that's what we want to focus on. You probably know the background of it, how it got passed through Congress a couple of years ago, knowing it's going to be slowly rolled out. Some of the things have already been rolled out already. Many of you who have children know that you can keep your kids on your insurance until they're 26 years old, which was a big change. Our family took a big advantage with that. We had kids in college. It really helped us. Pre-existing conditions will no longer exist after the January 1st start with this program. So if you have a pre-existing condition, you can still get insurance at the same rates that everybody else does, and you're not locked out of getting health insurance. In many states in this country, before January 1st this year, if you have a pre-existing condition, you cannot buy health insurance at any cost. You can in Oregon through a program we have where we share that in a big pool, but it's still pretty expensive. So what are we looking at here? We're looking at about probably 500,000 or 600,000 people in the state of Oregon who don't have health insurance. About half of them are going to be put in the Medicaid system. Those people are actually very poor people. They're below 138% of the federal poverty level. That's a number that changes by how many people you have in your family, but there's very low income. Above 138%, up to 40% of the federal poverty level, people will be going into what's called the health insurance exchanges if they don't have health insurance at their place of work. These are primarily individuals or very small businesses that can't afford to get health insurance for their employees. So what does that look like? People at the very low end of that will get a federal tax credit that can be only used for health insurance paying a premium. And that's what CoverOregon is all about. So if you're at 139%, your premium is almost zero. As you get up in the higher levels, the amount that you pay for the premium goes up also. But even at the high end, at 300% of the federal poverty level, It's probably in the range of, depending on the size of the family, genders, and where you're located in the state, probably around $300 to $350 a month for a good health insurance policy, which if you look at what's being paid out there is a pretty good number. It's going to be a new program for us. There's going to be some shaking, get this thing figured out. We've seen some of the early figures coming out, and they're about where we expected them to be. It's not been huge surprises. For the vast majority of people going into this program, it's going to be a real boon. They're going to come out very well. There's probably some people making in the $70,000 to $100,000 range that may have to pay a little more on their premium than they paid in the past, but they'll get a better insurance. They'll have a smaller deductible. It won't be $5,000 to $7,000. It'll probably be more in the range of $3,000 to $5,000. Their co-pays will be less. Wellness visits should be covered. So there'll be a better policy, but it will cost them a little bit more, but it's still a pretty reasonable number. So all that said, Oregon had to make a decision a couple of years ago whether or not we were going to work with the Affordable Care Act or whether we were going to ignore it. And I would tell you, the session before last and the last session, that was a significant discussion, and I'm using the word discussion very loosely, about what to do. Some of us said, this is the law of the land, it's not going to change, this is going to occur. I personally think it's a great thing, biggest step forward since Medicare in 1964. But others didn't feel that way. They didn't want to accept the plan, didn't want to get ready for the plan, didn't want to work with the plan, didn't want to take the money, said we're not going to do it. Luckily for Oregon, cooler heads prevailed. We are one of the best prepared states for the Affordable Care Act in the United States. We set up something called coordinated care organizations to take care of the huge increase in the Medicaid population. And we've set up CoverOregon, so we have an IT infrastructure for people to enter into this new market. Many states didn't do that. There's only 7 states that actually have, as I understand right now, an IT that actually works. Is that correct, 7? Is it bigger than that now? Last time I checked, it was 7. The states have been told if you don't put one of these programs together that fits your state, the federal government will put one in. There is discussion of taking CoverOregon, R1, and making it the national model. There's some other models that might be used too. But it's the way it's going to be. It's going to happen that way. And we were ready for it. So this state is ready for it. Again, there'll be some bumps along the way. We were hoping October 1st that small businesses and individuals could use a web-based platform to go right in and plug their name in, how old they were, where they lived, what their gender was, what their income was, and know exactly how much their premium was. Now the first 2 weeks of the program, we're not going to be able to do that. We're going to have to use brokers and navigators to help you do that. But you'll get help to do that. We think by the 3rd or 4th week of October, people will be able to go and do that. Small businesses, that's less than 50 employees, probably will not get into the system for, I don't think, for another 4 or 5, 6 months. Our sense is they don't really want to jump in there yet. They want to stay with the programs they've got and let this thing evolve. The biggest part of the market for this also is individuals. Small businesses are already a small part of it. So if we can get individuals into this the way we hope to, I think we'll be okay. Probably the most controversial part of this is penalties to those people who don't join. There's been a large, as you know, controversy about this with the Supreme Court. Many of us felt the Supreme Court would make the decision it did. We didn't think there was much question that it was not something that was unconstitutional, and they decided in our favor. I've always found rather 2 things I find kind of interesting about this part of the debate. Number 1, I went back and got some newspaper clippings from 1964 to see what people were saying about Medicare. And I assume a lot of you here are in Medicare. How many people are actually in Medicare right now? Quite a few. If you go back and read the debates about Medicare, same story. It's almost the same words. You know, it's the end of the world, Armageddon, end of freedom in America. We'll never have any health care again. All the physicians, AMA was opposed to it, American Medical Association opposed to it. It's going to be the end of the world. In fact, it turned out to be a pretty good program. So, yeah, I look at it from a historical point of view that we're going in the right direction. But getting everybody into this is going to be tough. There will be some people who don't want to join, and they'll have a small penalty to pay the first year. I think it's a couple $100, and they'll be picked up on their taxes. But by the 2nd or 3rd year, that penalty gets to be pretty significant. When you consider the fact that they can get insurance very cheaply, that penalty, we think, will drive people into the program. We want as many people in the program as we can, because the basis of all insurance is spreading the risk over a large population, getting everybody insured, and that lowers the price for everybody. I tell a lot of young people that think they don't want to join this, I say, you know, someday, in the blink of an eye, you'll be standing up on a stage in front of a bunch of people with a bald head and looking at Social Security pretty closely in the eye and thinking, what the heck happened to my life and how did I get this old this fast? Because it happens that quickly. And you're going to need this program when you get there too. It's your chance to pay ahead and pay into a system that's going to really safeguard you when you're in your 50s and 60s and on up. So that's the broad picture of this. The IT part that we prepared for, and we did so with about $100 million to get this program written and running, is what we call now CoverOregon. We used to call it the Health Insurance Exchange, but we wanted a name that was simpler and more straightforward. So the name was picked was CoverOregon. You've seen the advertisement. Half of them I don't understand. The rap one I just don't get. I don't put that thing together if you've seen it. But the rest of it made sense to me. And so we're trying to tell people what this is all about. And we're going out in public like tonight and walking you through it, giving you a good idea what that exchange looks like. And then what I found when I've talked to groups before, and I apologize right now, I have to leave at 7 to go to another meeting. When I'm talking to the groups, what gets down to it is the nitty-gritty. You start asking, well, what does it look like for me? I'm this age, I make this much money. What's my premium look like? What's my copay look like? What's my deductible look like? And that's what people really get involved. So you'll have a chance to do that in the second half of the program. I've given you a very fast overview. I'm reassuring you, this is not the end of the world. This is going to be a program that's going to work. There will be some people who will be upset with it because they'll be paying a little bit more on those high-end income people. But the rest of us should do very, very well. And I'm looking forward to being able to see people in my practice that I can take care of. And the last thing I ask them is, what's your insurance? Because right now, the first thing you usually get asked is, what's your insurance? Can you afford that MRI? Can you afford this prescription? And after 30 years, I'm sick of it. I just want to take care of patients and make them well if I possibly can. I don't want to be in a situation where my biggest concern is their financial aspects and getting them healthy. And I'm sick and tired of that, and I'm glad to get out behind this. I'm looking forward to another 15 or 20 years of medical practice if nobody throws me out. Right, Angie? And she's ready. My office manager's here too, and she's probably going, he is so full of it. But anyway, that's the way I feel, so I want people to know that. And I'm going to stop there because these people are really well versed with what they're going to tell you tonight. They're going to give you a great story about what CoverOregon is all about. I hope I put it in perspective for you as sort of a big picture, and they can take it down to a lower level and really tell you what it means to you individually. So thank you very much for your time and putting up with me.
Thank you very much, Senator. So now I'd like to introduce a few CoverOregon community partners who are here tonight. Community partners are vital to CoverOregon's mission, and they'll be important resources for you when you need help enrolling in health insurance. We're going to please welcome Erin Scow of Community Health Center, and also Lynette Robin, Enrollment Coordinator with La Clinica.
So my name is Lynette, and I'm from La Clinica. And La Clinica is a group of nonprofit community health centers whose mission is to provide quality medical and dental care to the whole community, but especially those that face barriers. So our staff can help residents determine whether they're eligible for the Oregon Health Plan and discounts that they might be eligible for the health exchange if they're not eligible for the Oregon Health Plan. So we're a community partner. We've partnered with CoverOregon, and we're doing some outreach events in the community to let folks know about Cover Oregon, and we're also making appointments to help folks that would like to use a community partner to enroll in Cover Oregon.
Hi, I'm Erin Scow. I'm from Community Health Center. I am the Enrollment Assistance Manager there, and I have the sisters at each of our clinic sites that are more than willing and excited to help people through this process and get through the Cover Oregon portal. October 1st is when we are starting to see clients to get them through the portal, walk them through it, and give them resources also as far as insurance agents if there's other questions that may come up during that appointment that we can't answer. Again, we're just here wanting to make sure everybody knows that we're available for you guys to come in and make appointments, sit with us and get through the portal and see what Cover Oregon has to offer for you.
All right. Thank you. So once again, my name is Dave Stickland. I'm a trainer from Cover Oregon. So I'm really here tonight just to give you a little bit of an overview about Cover Oregon, and then myself and Trish will do some breakout sessions later, and we'll answer some questions around individual, so the individual market, the individual application, and also around the small employer side of things as well. So we're going to split, after my kind of overview presentation at the start, we're going to split into those two different groups. So if I can have a show of hands, who's here that's really interested in the individual side of things, the individual application, individual market? Okay, thank you. And if you can raise your hand if you're here more for the small employer, small business side. Okay, it's pretty overwhelming that it's more of us are here interested in the individual market. Hands up if you're here for both, really. You would like to hear a little bit on both. Okay, thank you very much. So when we do split into the two different breakout sessions, after I've gone through about a 25-minute presentation on Cover Oregon, a little bit of an overview, a high-level overview, the individual session will stay in here in the main auditorium, and then the small group session will move next door to lecture room 2. It's a little bit smaller, and there are a few of us that are interested in that. About halfway through the breakout sessions, we'll ask you if you'd like to switch session. And then you'll have the opportunity to go in and sort of join in with the Q&A in the other breakout session. Okay, so like I said, I'm going to start off with a bit of a Cover Oregon overview. So what we're going to cover this evening, we're going to talk a little bit about what Cover Oregon is, what we do, who we are. We'll talk about the plans and carriers that are participating in the online marketplace, so participating in Cover Oregon. And we'll talk a little bit about timeline. We'll talk about what to expect in 2014, and then some of the changes that are going to come later on in 2016, and then even further down the line in 2017. There are some key dates, and there are going to be some key changes over time. And then, as I said just now, we'll talk about Cover Oregon for small businesses. So we'll talk somewhat about the benefits that we hope Cover Oregon will bring to employers, and then by proxy to their employees. And we'll also talk a little bit about Cover Oregon for individuals and families. So again, what we hope that Cover Oregon can do for individuals and families, and what we can really bring to the table. And then finally, we'll talk a little bit about online Q&A chats with Cover Oregon experts. But first, we're going to play a little game, a game of true or false, to see what you already know, information, knowledge that you bring with you tonight. I'm just rummaging through the papers trying to find the questions for you. So, only Oregonians who don't have health coverage can go to Cover Oregon for health insurance. False. Fantastic. That's true. It is false. Uninsured Oregonians, including small business owners and Oregonians who buy their own health coverage on the individual market, who don't get it through an employer, can now purchase health coverage through Cover Oregon. So, second question. So, some Oregonians may not be able to get covered if they have a serious pre-existing health condition such as cancer. Also correct. That is false. The Affordable Care Act, or sometimes more commonly known as Obamacare, stipulates that insurance companies can no longer deny coverage to someone who has a pre-existing condition. I'm sorry, that was just the explanation. So the third question would be, employers who have less than 25 employees who make on average $50,000 or less may be eligible for a tax credit. That's right, it is true. And then finally, all health insurance plans are now required to cover things like doctor visits, prescriptions, ER visits, mental health and prevention and wellness. True. Yeah, all plans moving forward in 2014 will need to include the essential health benefits package, those 10 essential health benefits. Excellent. So obviously we already know quite a bit coming to tonight. We're hoping just to kind of add to that existing knowledge. So what is CoverOregon? CoverOregon is a new online marketplace, and we tend to refer to ourselves as an online marketplace, not an exchange, although in the legislation that's what we are. But we are a new online marketplace where Oregonians can choose from different health insurance companies to find plans that will fit their needs and budget, and access extra savings to help pay for coverage. We'll talk a lot about financial assistance tonight, who's going to be eligible, and how that's going to help to make coverage more affordable to all. So CoverOregon's mission is to improve the health of all Oregonians by providing health coverage options, increasing access to information, and fostering quality and value in the healthcare system. We've already heard from some of our community partners tonight, and Senator Bates talked a little bit about the launch in October, the first couple of weeks. Our agents and our community partners are absolutely essential to help us achieve that mission. There's a large education piece that's going to take place in the first 6 months during open enrollment towards the end of 2013 and into 2014. And we're going to rely heavily on those community partners to help us achieve that mission. So a little bit of background about CoverOregon. Firstly, as Senator Bates has already touched upon, we were created in 2011 by the Oregon legislature, and actually created by a bipartisan vote. We got bipartisan support passing the Senate Bill 99. And we were formed as a public corporation, similar to the Port of Portland. We are a key piece of the Affordable Care Act. The formation of the online marketplaces, those state exchanges, are a critical part of the legislation, and actually initiating and putting into practice, putting into reality the theory. And finally, we are custom built for Oregonians. We've already talked a little bit tonight about how many of the states are going to be federally run state exchanges. In Oregon, we opted to really run our own program. We have a state exchange which is designed by Oregonians, built by Oregonians for Oregonians. And so one example of that would be our customer service center is actually in Salem. So it's staffed by Oregonians in Oregon, and that was important to the people of Oregon. So a little bit about that timeline that we touched upon that we would cover in our sort of objectives tonight. In October, open enrollment will begin. Open enrollment in the first year is a 6-month enrollment period. It's going to run through to the end of March 31st, 2014. So there is time. There's time to make a decision. We don't need to rush in. We don't need to overwhelm the system and all flood in at once. We can take time to research, to talk to our community partners, to make informed decisions. But the important point here is that if we want coverage to be effective as of January 1st, we're going to need to enroll in coverage by December 15th. So that is a very important deadline. And then, as of January 1st, as we've said, coverage for those commercial plans will begin. And then by March 31st, that enrollment period will end for the individual market. And we'll talk a little bit, particularly in the breakout session, about special enrollment periods and some of the qualifying life events that will queue and initiate special enrollments, and an opportunity to shop for and enroll in coverage outside of that open enrollment window. So a new day for healthcare, or health coverage rather. Things are different in the past, and they will be tomorrow or very shortly in the present when we get to roll this program out in October, and things will continue to change as we move forward into the future. Plans will be new. They have new criteria, such as containing the essential health benefits package. So the sands are shifting and things are changing and will continue to change. So some of those changes you can see up on the screen, the first of which we've already touched upon tonight. People can no longer be denied for pre-existing conditions. Our carriers, the insurance carriers, can only adjust premium rates based upon 4 criteria: individual versus family enrollment, geographic area, age, and finally tobacco use. Those are the 4 factors that they can adjust someone's premium rate on. So all plans in 2014 will be required to contain those 10 essential health benefits, and we'll look at what those are a little bit later on. And then by purchasing coverage through CoverOregon, people will have access to financial help. Only by purchasing coverage through CoverOregon, both in the small business and in the individual market, but financial assistance is available to people. And once again, Senator Bates talked a lot about the federal poverty level, those thresholds earlier on, where people will be eligible for financial assistance. The idea of making it equitable and affordable to all. There is a requirement to have insurance. We talked briefly about the individual mandate earlier on to ensure that the system works. People, US citizens, legal immigrants, unless they have an exemption, which there are only a handful, will be required to have coverage moving forward. They'll be required to have health insurance. And we as CoverOregon and other online marketplaces throughout the country, nationwide, will facilitate that process. And so finally, the last bullet there is really talking about medical loss ratio. And again, a part of the legislation is to ensure that carriers must spend 80% of premiums on care. Only 20% of premiums can be spent on administrative costs, profit. So what plans are available through CoverOregon? We're extremely fortunate in Oregon to have great participation from our carriers, from our insurance carriers. And you can see in Jackson County, we have, quick math, eight carriers that are participating, and it does vary from county to county. But in the individual medical market, we have 8 carriers participating, and you can see them listed up on the screen. And then in the small group market, so for small businesses, plans are going to be offered and sold through CoverOregon, through the online marketplace, by those 6 carriers. So again, we're extremely fortunate. We have employer plans and individual plans in every county. We have a choice of carriers in every county throughout the state. And that is thanks in large part to the participation of our carriers. So in Jackson County, that breaks down. We can see the plan choice. We can see how many plans that equates to. How much choice do we actually have as an individual or a family or as a small business. And we can see there are 54 plans in the individual market for people to choose from. And in the small group market, we have 41 choices. And there are 12 that are HSA qualified currently. So in the Medford area, we've got a breakdown of really what that means in terms of individual rates. How much is this really going to cost? And as we said earlier, it does depend on those different rating criteria: age, geographic area, tobacco use, etc. But that gives you a rough idea. These are all non-tobacco user rates that we can see. It gives you the range of the premium cost that we're talking about here for the different levels of coverage. Along with having essential health benefits, one of the changes in 2014 is all plans are going to fit into 4 different levels of coverage. We call them metal level tiers. And we can see the individual rates here. We've got quoted on bronze plans, silver plans, gold plans for non-tobacco users. And we can see the range for the different age groups there. And that's really just a snapshot. It gives you a little bit of an indication, a bit of an idea, but you can see there's a link to a website at the bottom, OregonHealthRates.org. I would encourage you to go to that website to look in more depth at the rates that have been filed. So that was the individual. So for the small group rates in the Medford area, again looking at bronze, silver and gold, the different metal level tiers, we can see again depending on age and the level of coverage, we can see the price range for those groups. So we've talked quite a bit already tonight about the qualified health plans, the QHPs, the commercial market. But in addition to that, CoverOregon is a one-stop shop. We will deal with eligibility determinations for both Medicaid and CHIP, which are the funding pools for the Oregon Health Plan and the Healthy Kids program, which are the brand names. So there's public medical programs and also the eligibility determinations for people that may be eligible for tax credits, cost share reductions, who will purchase a commercial plan in the commercial market, one of those qualified health plans. So we're a one-stop shop. Everyone can come through our door and get an eligibility determination and then shop according to whatever that level of financial assistance is. Whether it's the no-cost healthcare coverage with the public medical programs, the Oregon Health Plan for adults, Healthy Kids program for children under 19, or whether it's the qualified health plan in the commercial market. So we talked earlier on about those essential health benefits, the minimum set of core benefits that need to be included in all plans moving forward. You can see them listed up on the board. Writing might be a little bit small for those of us that are in the back row. So I will read them out to you. So those 10 essential health benefits are hospitalization, pediatric vision, ambulatory, emergency services, laboratory services, prescription drugs, mental behavioral health, maternity, newborn care, prevention and wellness, and rehabilitative and habilitative services and devices. Bit of a tongue twister there. So the individual market, individuals and families will have access to financial help, as we've said. So above 400% of the federal poverty level, so 4 times the FPL or federal poverty level, people will have self-pay access to plans through CoverOregon. In other words, their income is too high to receive any financial assistance, but they're still able to come through and shop through CoverOregon. That's still an option for them, and there's many reasons why we hope they will. But for people who have earned less, their household income is less than 400% of the federal poverty level, on a sliding scale down to 250% of the federal poverty level, so 2.5 times the FPL, those people will receive tax credits to help lower the cost of their monthly premiums. And then from 250% down to 138% of the federal poverty level, people may be eligible for additional assistance through cost-sharing reductions. And the cost-sharing reductions help to offset the cost of their co-pays, their co-insurance, their deductibles, their cost-sharing, whenever they access services. And then below 138%, people will be eligible for the public medical programs. So Oregon Health Plan for the adults, and below 300%, children will be eligible for the Healthy Kids program. So, secondly, one of the key objectives of the legislation was really to make it more transparent, to make the industry more transparent, more understandable, comprehensible to Oregonians, to the general public whose livelihood and profession is not in the industry. So the objective was to make it so that carriers would use uniform terminology, medical terms, insurance terms, so that consumers would be able to really compare plans and really know that they're comparing apples to apples, that they can make side-by-side comparisons. So that's a very, very important part of the legislation, and that's where CoverOregon fits in. Our portal, our system will allow you to do that. You'll be able to compare up to 3 plans side by side and look at a really detailed plan summary listing the benefits and the plan design. So as we said before, we're a one-stop shop, so everyone can come through our door and enroll in coverage. And we will help people to be able to see the quality coverage and grade. So we've contracted with Quality Corporation, or Quality Corp, Q Corp, and they have rated the carriers on a 4-star rating system so that we can see the quality of those carriers. And they report on 11 different metrics, 11 different measures in order to come to those stars, those quality measures. And then, of course, we're there to help enroll people in Oregon, and not just CoverOregon staff and the CoverOregon portal, but our trusted and certified community partners. So our community partners, our application assisters, our agents, all going through training. They're all contracting with CoverOregon. And so hopefully they really know what they're talking about. And they will very much help with the outreach and assisting people to enroll in coverage that's right for them. So we talked a little bit about metal level tiers earlier on with those 4 different levels of coverage. But that can be kind of a little bit of gobbledygook. So to break that down and think about what we mean in terms of comparing premium costs and co-pays or cost sharing, with our different metal level tiers, as you would imagine, the more precious the metal, the more rare the metal, platinum, gold, the more expensive the metal, the more expensive the premium. And the less expensive the metal, like bronze, cheaper the premium will be. But offsetting that, the lower the premium cost is, the less of the healthcare costs will be covered by the plan. So with those bronze level plans, it's going to be a lower premium each month, but the plan itself will only cover 60% of the costs of the plan. And so 40% would be picked up by the individual. Okay? So the more we use services, the more that would cost. So it's really trying to determine what's going to be a better fit. Is it better to pay more each month, pay a higher premium, and then have the plan cover more of the costs of the benefits? So, if we have to use services, or whether we want to pay more in terms of the premium and then less in terms of utilizing those services. And within CoverOregon, we can also offer a catastrophic option. Carriers are able to offer one catastrophic option, and they don't have to, and not all carriers will or have, but carriers are able to offer one catastrophic option. But it's only available through CoverOregon, it's only available in the individual market. And those tend to have lower premiums. They still include all of the essential health benefits. They satisfy the individual mandate. They are not, however, eligible for tax credits. But that is another option to those that are under 30 or those that are exempt from the mandate for hardship. So just to have a look at that in terms of, we've referenced the federal poverty level a number of times, and that's not really all that helpful because we don't know what 100% of the FPL is, so it's kind of difficult to know, okay, 250%, 2.5 times, I don't know what that means. So when we actually look at it in terms of a dollar value, you can see that what that means in terms of to an individual or a family of 4 or a family of 2, family of 5, you can see what that equates to in terms of the household income. So for a family of 4, 94,200 currently, that's based off of 2013 numbers, likely to go up slightly in 2014. But under 94,200, a family of 4 is likely to be eligible for some form of financial assistance. And as that income drops, that household income decreases, the amount of financial assistance that someone's going to be eligible for increases. So for small businesses, we hope that with our carrier participation and the level of choice, the employee choice level that CoverOregon can offer, employers are going to be able to offer their employees greatly increased choice. And we're going to be able to offer small employers, just like in the individual market, the portal is going to enable them to access clear information around the plans that they're choosing for their employees. And really, it's going to be budget driven for the employer. They're going to be able to set their defined contribution, and then they're going to be able to set up the amount of choice that they want to give to their employees, whether that's one plan or lots of plans with our broad choice model, our broadest choice. And then they'll have that defined contribution, and then the employees can go away and choose the plan that's right for them from the carrier that's right for them. The employer no longer has to make the decision. It eliminates that shopping burden from the employer. So they can now give the employees the choice and hopefully that will increase the employee satisfaction. It empowers employees to make the choice that's right for them. We'll talk about this a lot more in the breakout session, because I know there weren't very many hands that went up for the small group market, but it's also streamlined administration. CoverOregon will invoice the employer and will give them one itemized bill, which will break down how much to deduct from each employee's paycheck. And then CoverOregon will take that one payment from the employer, and on the back end, we will redistribute that payment to all of the different carriers. In theory, given the amount of choice in Jackson County, it's very possible that if it's a larger small employer, say 30 employees, and we're offering dental and medical, we can choose a dental which doesn't match the medical carrier that we opted for. So it's very possible we could be reconciling with 6 different carriers or more. So it's one bill to the employer. CoverOregon will take that payment, and then we will worry about redistributing it on the back end. And thankfully we've got a great finance team who will take that on. As with the individual market, only purchasing coverage through CoverOregon will enable a small business to access the tax credit. So again, financial assistance, whether it's individual market or small group market, is only accessible through CoverOregon. And so really, just kind of briefly going over the eligibility for tax credits, CoverOregon doesn't deal actually with the eligibility determination for a small business tax credit. That's something that a small business owner would need to consult with their CPA, their tax professional, tax consultant on, unlike in the individual market where CoverOregon does determine the eligibility for financial assistance. But there are 4 criteria that need to be met in order for an employer to get a small business tax credit or be eligible for one. They need to employ fewer than 25 eligible FTE, so full-time equivalent employees. They need to have their employees earn an average wage, annual wage of less than $50,000, and they need to agree to pay at least 50% of the employee-only premium. And if they do those things, then the small business, if it's a for-profit business, then they can be eligible for up to 50% of their contribution as a small business tax credit, or if it's not-for-profit, up to 35%. And again, it's set on a sliding scale. So the employee choice level that we talked about earlier, an employer, when they're going through setting up, going through the employer application, they can offer their employees just one choice, single plan. They could offer their employees the carrier choice, which would mean that those employees would be able to choose from any plan, from any of the levels of coverage, the 4 different levels, the metal level tiers, but from one carrier. Or the metalist option, which gives them more choice, enables a small employer to offer their employees choice from all carriers participating in that area, but restricting them to one metal level tier. So for example, up on the board we can see the silver tier. And carriers can offer up to 3 plans in each metal level tier. So if there were 4 carriers participating in an area, that would equate to 12 plans that would be an option, or up to 12 plans that employees would choose from. And then broad choice is our broadest choice, and we can see there that it can, we can offer all plans from all carriers with the broad choice model. And we'll go into that a little bit more detail later on. So timeline for employers. In 2014, CoverOregon is going to be working with groups between 1 and 50 that will constitute a small group. Moving forward, by 2016, that will be expanded to 100. So small groups, CoverOregon will be able to work with groups between 1 to 100, and then beyond, potentially 101 plus in 2017. So how can you apply? Individuals and families will be able to contact CoverOregon through our customer service center, and the number for the customer service center is up on the screen. Call 1-855-CoverOregon, or CoverOre, I should say. And in the first 2 weeks of October, potentially the first 3 weeks, we'll connect you with a community partner, one of our certified trained agents or community partners. in your area, and they will help you enroll in coverage. Some information that you'll need in order to be able to complete the application. You're going to need your social security number if you're a citizen. If you are a legal immigrant, you may need your residency card so that you can read off your A number, your alien registration number, or your immigration documentation. You will need some income documentation as well. You're going to need to fill out the household income section of the application in order to be able to determine your eligibility for financial assistance. So, for example, a recent pay stub, tax return, those types of documents will help you. And then finally, documentation about any health insurance plans that currently cover household members. So once you get to the shopping piece, you'll be able to search for plans by those different factors. You'll be able to look on price, how much does the premium cost. You'll be able to look by looking at provider, so you could select a provider or a couple of providers that you're loyal to or interested in, that you have a preference for, and search only on plans offered by those providers in that area. You can search on quality rating, etc. So that's an example of what our homepage is going to look like, that you'll be able to access on your own towards the end of October, or again in partnership working with one of our community partners. So when you log into the portal, when you go to the website, that's what the homepage looks like. You'll be able to search the database in order to find help. So you'll be able to search for agents, community partners, using the search functionality in the website. So you'll be able to search on a name or ID number, assisted type, county, zip code, language preference. So you'll be able to find help through the portal itself. And that's just a screenshot of what it looks like when you press search. It'll bring up a list of agents or community partners that will be able to assist you in your area. And then, we would recommend that you do some research, that you contact them, that you have a conversation with them, and then you choose an agent to work with. If you currently don't work with one, if you already work with an agent, hopefully they'll be reaching out to you, and you can continue to work with that person that you already know and trust. So marketing and outreach, we have an integrated campaign that's been rolled out over the past several months, began in July. We have a mass media campaign. We talked a little bit earlier about our TV advertisements, our ads. We have 4 different ads that are running that are more kind of creative. That really was phase 1, that was just trying to create awareness of who we are, get some brand recognition. But then hopefully you'll be starting to see at the moment some more educational TV ads which are really talking about what you need to do next. But we also have billboards, we have marketing materials, we have community meetings such as tonight, where we're really trying to reach out to the community and educate people on what we do and really the changes that are coming. So since we're running a little bit behind time tonight, I'm going to kind of gloss over showing you the TV ads fairly quickly. So instead of showing them to you tonight, hopefully you've all seen them. But Matt Sheehy is one of our artists. All of the artists, the musicians, are artists who have created the artwork for the billboards, our internet flyers, etc. And they're all Oregonians. It was very important to Cover Oregon and to our ad agency, North, which is also based in Oregon. It's very important to keep the dollars that we spend on our advertising in Oregon. So Matt Sheehy, Long Live Oregonians, is one of the TV ads you may have seen. And then Laura Gibson, Live Long in Oregon, is potentially another you may have seen on TV. So those are a couple of examples of our billboards. And then, in addition to our mass media campaign, you can also connect with us through a variety of different social media sites, Facebook, Twitter, YouTube, etc. You can see them listed on the board. So I was a little bit conscious there of not wanting to run too long with the overview, because I really want to get into the breakout sessions and start to really hone in on the areas that you're specifically interested in hearing about tonight. So we are going to break into those sessions now. So again, if you're interested most in the individual family side of things, in the individual market, the individual application, please stay in this auditorium, and Trish is going to give you a brief overview of the individual market and then open up the forum to a Q&A session. If the small group market is more what you're here tonight to hear about, please go next door to lecture hall 2, which is a slightly smaller room, and I'll be leading that session next door. And then after about 20 minutes, we'll give you the opportunity to go next door to then join in the Q&A in the other breakout session.